Well, Democrats scored a big victory in the House over the weekend, but the more difficult battle over health care reform begins right now.
Gentlemen's out of order.
After a tough and grueling debate, Democrats prevailed in the House by a razor-thin margin.
The yeas are 220, the nays are 215. The bill is passed.
Only a single Republican voted for it. 39 Democrats and all the other Republicans voted no.
This bill steals freedom, and those of us that believe in freedom have contempt for those who would steal our freedom and contempt for this bill.
The $1.1 trillion bill would extend health care coverage to an estimated 36 million uninsured Americans over the next 10 years. It would require everyone to have health insurance and all employers to provide it or pay penalties. And it would give subsidies to those with lower incomes to help buy insurance. To pay for it all, more than $500 billion in new taxes, mostly on the wealthy, and more than $400 billion in reduced Medicare spending. It's the most ambitious bill to pass the House in more than a generation, but its fate in the Senate is uncertain.
Let's start with the House bill. The House bill is dead on arrival in the Senate. Just look at how it passed. It passed 220 to 215. It passed by 2 votes.
And in fact, things are moving much more slowly in the Senate, where Majority Leader Harry Reid hasn't even introduced the bill that the Senate will take up. Diane, the White House wants to see this passed in a form that the president can sign by the end of the year, but Senate Democrats are telling me that that will be virtually impossible. This is almost certainly going to go into next year.
All right, John, thanks to you. Well, if the president gets his wish on a bill either by the end of the year or the beginning of next year, we had a simple question. What changes first in the lives of ordinary Americans? And for that, we bring in ABC News Chief Medical Editor Dr. Tim Johnson. Simple question. Get the calendar out and just show us, according to these bills, what will change first for all.
All right. If we just take a look at right after the first of the year or whenever the bill is signed, right away, there are going to be some new limits on pre-existing conditions. Reduce the window from 6 months to 30 days where insurance companies can look for pre-existing conditions. By 2013, they'll be all gone, but at least this is a step in the right direction. They also allow parents, if they choose, to keep their insurance on their kids until they're 27 years old, which is a big advance because it gets rid of that window where kids often fall through the cracks between graduating from college and finding a job with benefits. Another thing that is going to happen right away is to allow people who are losing their jobs to extend COBRA indefinitely until the full bill is passed in 2013. Now there's a limit, I think, of 18 months. Varies from state to state a little bit, but that'll help people who lose their jobs. It's expensive, but at least they'll have something.
Right, for a couple of years. Now, for the elderly, there's talk of closing right away this window in which you have to pay more for prescription drugs.
The infamous donut, yes.
The infamous donut.
They're going to start closing it. They're going to reduce it by $50 initially, keep closing it until it's completely closed by the end of the decade. They will also allow people to buy brand name drugs at a 50% discount. So some help to seniors right away.
And other change in July.
Well, here's one, of course, that just really irritates people when they have insurance, then they get sick and their insurance want to drop them because they're sick when they most need it. That will be prohibited supposedly starting July 1 of next year. So that's also a real advance.
And these grants for wellness programs that will also kick in. What kind of thing is that? Companies have to do that?
That's mostly for small companies that don't have the money to do it. Now, big companies often do it, but the small companies need the money. They're going to get the grants. That's for prevention, fitness, et cetera. That'll help a lot of people.
So these are the things that would happen in the first year.
In the first year.
But the big changes, the mandates kicking in, that would be later on.
All the stuff Jonathan talked about, mandates, the insurance exchange, the public option, if it survives in the Senate, all those truly major rock bottom changes. We got about 3 years before they're in.
All right. Well, at least we can fathom the first year.
We can, and
after
it's
a
something.
bill is passed. That's something. Thanks, Tim.